Good morning. My name is Bonnie Jackson, and I am a volunteer with the ARP Arizona Community Education Program. And this is a volunteer-led program that offers basic conversations on such topics as Social Security, Medicare, caregiving, fraud, finances, and others. And today we're going to have our focus on Medicare Original, and we're going to look at the ABCDs of Original Medicare. Our goal today is going to be to provide basic information on Original Medicare. And that would cover Part A, hospitalization, Part B, which is medical, Part D is prescription drug coverage, Medigap or supplemental insurance, and Medicare savings plans and extra help. And then finally, some resources that can be very valuable to you. If you're wondering who qualifies for Medicare, it's anyone who is 65 years old or older and has earned 40 credits during their employment history. That would equal 10 years of employment, and it does not have to be consecutive. Sometimes people take time off, they start working, and then they stop to raise a family, to travel, to do any number of things, and then they come back to work. So as long as they have 10 years of employment where they've paid into Social Security and Medicare, they will qualify. Also, if individuals are covered by SSDI or disability for 2 years, after your second year, you would automatically go on Medicare no matter what the age. And anyone with end-stage renal failure or Lou Gehrig's disease would qualify. And now I'd like to introduce Jerry, one of our vital volunteers, and he is going to cover some more details about Original Medicare.
Thank you, Bonnie. So let's talk about the various parts of Original Medicare. First is Part A, which is hospitalization. And under hospitalization, the coverage includes inpatient care in the hospital. And typically that means you have to be admitted to the hospital. You may be in the hospital, but only under observation. That is not Part A coverage. You must be admitted to the hospital, and generally that's a 3-night stay for Part A to kick in. It also covers skilled nursing facility care, hospice care, and home health care. The good news about Part A is generally, for most people who have worked in their careers, there is no premium. You've paid for Part A if you have 40 credits, and that means 10 years of employment, 10 years of paying the FICA tax or self-employment tax. And that covers you or your spouse. If you do not have that work history, you may purchase into Part A, but it is expensive. The deductible under Part A is a little different than most deductibles. This is not an annual deductible. It's a deductible per benefit period. And that amount is $1,408 for 2020. It may be bumped up a little bit in 2021. Now, per benefit period is a little bit different, as I said, than annual, because the benefit period is defined as the point when you enter or are admitted to the hospital, you're discharged, then go 60 days without any readmittance to the hospital. That, again, that's admittance to the hospital. You're released and you go 60 days without need for further hospitalization. That would end that benefit period. Once that benefit period is ended, you will be responsible for that deductible, $1,408. After that period, if you have to go back to the hospital, you will start a new benefit period. So therefore, you could have multiple, more than one benefit periods within the course of 1 year. Now, there is coinsurance under Part A, and the good news is that for days 1 through 60, admittance in the hospital, that coinsurance is zero. There's no additional charge. Days 61 to 90, there's a $352 a day charge for that coverage. And days 91 to 150, you'd be charged $704 per day. Now, it's important to note that days 91 through 150 are a one-time only reserve that Medicare tracks for you. Once you use those days, 91 through 150, they're gone. And your coverage will only be days 1 through 90 if you need to go back in the future for hospitalizations. Part A also covers skilled nursing facility care. And from days 20 to 100, the charge for that is $176 per day. That's Part A, hospitalization. So let's move on to Part B. Part B is medical insurance. It's medical coverage. And that covers your medical care with your doctors and your specialists. It also covers outpatient care, which many of our surgeries now are. It covers durable medical equipment, which you might need after a hospital procedure. And it covers many preventive services. The premium for Part B is a set dollar amount. The amount in 2020 is $145 per month. Now, you'll note it says that it is means tested. There are about 6 categories of premium based on your annual income. So the base premium is $145 a month, but for higher earners, you may be paying more per month for that service, or for the coverage under Part B. It can get expensive based on your earnings. The premium will be bumped up a little bit in 2021. That has not yet been announced, but you can expect a slight increase in that based on the Social Security cost of living increase. There is a deductible under Part B insurance, and that is $198 per year. Once that's paid, the coverage becomes more effective. The copayment, there are no additional copayments with Part B, but there is coinsurance, and this is a very important factor for many people because it can get expensive. The coinsurance is 20%. So under Part B, any procedures you have, doctor visits and so forth, Medicare will pay 80% of those typically. You will be billed for the remaining 20% of that service. That can add up, but we will talk later about how to possibly cover those costs by buying an additional supplemental plan. We should note that Part B is optional. You do not have to purchase Part B medical insurance. You can let that go. If you have employer-provided coverage, you can wait till your employer-provided coverage ends, then purchase Part B under Medicare. Or if you choose not to purchase Part B and don't have provided other covered insurance, you will be charged a penalty. And the penalty can add up, and that is a lifetime penalty for that of 10% per year. So let's move on to Part D, which is drug coverage. This is the other important component besides hospitalization, medical coverage, and there's drug coverage. So this is a third leg of that stool. Drug coverage provides, obviously, coverage for prescription drugs, and these are through private insurance companies, and there are many, many of these in most marketplaces. The premiums vary significantly based on the plan chosen. Here it says typically they're $13 to $30 a month. Typically, these are means tested. Again, based on income, higher earners are going to have to pay more for the same plan. If you search these plans actually in your local area, you may find one that's less. I just did this yesterday. One of our plans here is $6 a month, but they can also range to a very high dollar amount. It's close to $100 a month. On the deductibles, some of the plans do have deductibles and can be more expensive than others. You want to search each plan just to see what that deductible will be based on the plan you choose. There typically are co-payments for drugs, and they vary by policy and tier. And the point about tiering is important to know because you have to check the formulary of that company, of that plan. And the formulary is what drugs are covered and what's the tier of the drug that you need. Certain tiers offer a lower co-payment to you. Other tiers mean that you'll have to pay more out of pocket for that drug. And there is coinsurance under Part D. This gets a little complicated because it's tiered. The first tier is total drug expenses up to $4,020. The coinsurance is 25%. That means you will be responsible for 25% of the cost of that. In the second tier, from $4,020 to $6,350, you again this year are responsible only for 25% because the drugs are being discounted to provide you effectively with a 25% coinsurance. Beyond $6,350 in total drug costs, you enter what's considered a catastrophic phase, and you'll only be responsible for 5% of the drug cost. That's Part D, or drug coverage. Now let's talk about what is not covered. And there are several things that are not covered under Medicare, and it's important to realize this and understand it entering into it. First is long-term care. There are other insurance options to provide for long-term care. Dental coverage, same thing. You may have to look at purchasing a separate dental plan. Dentures are not covered. Typically, eye examinations related to prescribing glasses would not be covered. Cosmetic surgeries, acupuncture has not traditionally been covered, but in 2021, as a new benefit, it will be covered. Hearing aids and exams for fitting those, typically not covered, and routine foot care also would not be covered. Now let's talk a bit about Medicare and the use of other insurance coverage. And we're going to talk about Medigap, or supplemental insurance. You might have heard either of those terms used interchangeably. Medigap is available only with original Medicare, which is what we're talking about in this video. Medigap can pay for deductibles, co-payments, and coinsurance for Parts A and B. In other words, all those out-of-pocket costs you might have in Parts A and B. There is a 6-month sign-up protection period against pre-existing conditions. When you are first eligible to sign up for Medicare, it's important to make that decision. If you want Medigap or supplemental insurance, it's a good idea to buy it then, within that original 6-month period, because you won't be asked about your health history. You're protected against pre-existing conditions during that period. So it's a good time to purchase that insurance. Medigap may also include foreign travel and emergency protection. Medicare coordinates with other insurance coverage, employer insurance, if you have union insurance or veterans insurance, TRICARE, federal insurance, and long-term care insurance. Medicare will coordinate with those other providers. Typically, Medicare functions as the primary insurer, but in some cases, and it may be secondary in certain cases, depending on the other plans that are offered. This is a chart of Medigap, types of Medigap plans that are available. And these plans are all labeled A, B, D, G, K, L, M, N, because those letters define what the plan costs. These are private insurance companies that provide these plans. And if you talk to any of these companies, all you have to say is, I'd like to talk about an A plan or a B plan or an F plan or a G plan. The coverage under those plans is standardized. Medicare has required that, and you'll see on the left-hand side of this chart what is covered. And by the X's, you'll see which plan covers what type of service. The most comprehensive plans are the G plan and on the far right-hand side, the F plan. But you'll note plans C and F are no longer going to be available to new enrollees. If you have a C or F plan currently and are using Medicare, you will be able to continue to purchase that. Those have been grandfathered. But new enrollees in the Medicare program will not be able to purchase those going forward. So the main part of the chart are the letters that have survived: A, B, D, G, K, L, M, and N. G is the most comprehensive. A is the least comprehensive. So you can search the companies that provide these through the Medicare website, medicare.gov, and see what's available to you. And each of those plans are priced individually by the private insurance companies that offer them. With that, let's move on to Medicare savings programs and extra help. And I believe, Bonnie, you're going to talk about these things. We need your microphone, Bonnie.
Thank you, Jerry. Medicare does provide savings programs and extra help for enrollees, but it will be based on income. And generally speaking, if you are a single person and your income is around $19,000 a year, and they look at your other resources as well. That would be if you have a retirement plan, if you have an IRA, stocks, bonds, anything like that, that cannot be over about $13,000. And when you put those two figures together, if you are below that range, you would qualify for the qualified individual Medicare beneficiary, and that would cover your Part B premium, your deductibles, your co-payments, and your coinsurance. The next category is it's specified low income beneficiary, and that will only pay for the Part B premium. And then the qualified individual would also pay for Part B premium, but this is on a limited basis. So it's first come, first served. So if you think you qualify, I'm going to give you some resources in a few minutes where you can contact them and talk about your individual financial situation, and they will direct you to the appropriate person to talk about getting some help. I forgot to mention, if you're a couple, a married couple, and your income is around $26,000 a year, and your additional resources are also around $26,000. If it's below that level, you could also qualify for these extra help plans. The other resources will not include your home and car and things like that. It's only retirement plans and investments. And the last one, the Medicare extra help, the LIS, that's going to assist you with your Part D costs, which can be quite high if you have a lot of medication. So let's go on to the next slide. When it comes to Medicare enrollment periods, your initial enrollment period, it's going to run for 7 months, and it starts with 3 months prior to your 65th birthday month. That 65th birthday month, and then 3 months beyond that. And during this initial enrollment period, you can sign up at any time and not pay any penalties. There's also a special enrollment period because you may turn 65 and you're still working and you are being covered with your health insurance through your work, so you don't want to sign up for Medicare necessarily. But if something happens and your job ends for whatever reason, or you retire, you are going to have an 8-month period where as long as you have creditable coverage, you can sign up for Medicare and not pay any penalties. But you need to discuss this with your HR department, because COBRA is not considered credible. And a lot of times when, like if they have to cut back on staff and whatever, and they let you go, they will maybe provide COBRA insurance for you for a year. Well, that is not considered creditable insurance. So you need to talk with your HR department. The general enrollment period is from January 1st to March 31st if your initial enrollment was missed. So you wouldn't be penalized. After that, the penalties can be quite stiff, and they are for the rest of your life. And so the penalty could apply on Part B, 10% a year, if you don't sign up for Part B during your initial enrollment time or under the special enrollment period. When it comes to the Part D prescription drug cost, that's a 1% penalty per month for the rest of your life. So you really do want to look at all of the options and make sure you've made a decision in a timely manner when it comes to signing up for Medicare. And all new coverage starts July 1st. Open enrollment for Medicare Advantage and Part D is going to change. It's going to be October 15th to, you can make changes from October 15th to December 7th. So if you are currently enrolled and you want to make a change, that's the time to do it, between October 15th and December 7th. If you want to change from Medicare Advantage to an original plan, there is an extended period of time where from January 1st to February 14th where you could go to the original Medicare plan. However, pre-existing conditions may influence the plan price. Some people start out with original, then they change and go to Medicare Advantage, and then they decide they want to go back to original. But you do have to consider if there's any pre-existing conditions, it could really influence the price of your plan. So lots of things to think about when making those decisions. My advice to you is to be proactive. If you receive Social Security, you might be automatically enrolled in original Medicare Parts A and B, but not D. So if you are already collecting your Social Security, a lot of people start that at age 62 or 63 or whatever. So when they hit 65, they may be automatically enrolled in original Medicare for Parts A and B. If you think that's where you want to stay, all you need to worry about is getting a Part D plan. But if you want an Advantage plan, then you need to make sure that you switch over to an Advantage plan, and that they will then send your Part A and B premiums over to the Medicare Advantage. You can enroll online at ssa.gov/benefits/Medicare. And they actually make it very, very easy for you to do that. But if you have lots of questions, or you're not as comfortable using the online enrollment, you can call them, and I will give you that number in a minute. But don't procrastinate or avoid any decisions, because that can cost you dearly. The State Health Insurance Assistance Program, SHIP, this website, shiptacenter.org, when you go there, they're going to ask you what state you are interested in, and you would enter Arizona, and they would then connect you with people who could answer your questions about Arizona. Also, the area agencies on aging, you can call them at 800-432-4040. This is an excellent source for knowledgeable, unbiased information. They can either come to your home or you can go there for on-site counseling. And in this day and age with the stay-at-home thing, some people are more secure staying home, so they will come to you and discuss it. Also, you can contact Medicare at medicare.gov or call them 1-800-633-4227. And ARP, ARP.org/Medicare QA, they can also answer many of your questions, or you could call them at 1-888-687-2277. All of these are great resources. I want to thank you for tuning in today, and thank you, Jerry, for your excellent presentation on Original Medicare.
Thank you, and thanks to all the volunteers today.